Hello, Hop Hopper. Hello, Spotify. Ladies and gentlemen, on my podcast or on my YouTube or on my whatever, this is Turquoise, Carol, or Carol Turquoise, whatever you want to call me. I'm the administrator and founder of Mental Health Ethics and Social Health Mesh. Thank you for listening to another episode in July of 2025. This is your monthly update of how I'm doing and how I've been applying my mental wellness process. I must say it's been saving my life, especially combined with my ideals code of universal ethics. Today is Wednesday, and my principle for today is ethical love in my ideals code of universal ethics. And I also practice 5 modules of mental wellness: life purpose, behavioral awareness, life experiences, emotions and thoughts process, and mind and body connection. I'm not a therapist or a psychiatrist or a doctor or a spiritual advisor or clergy or physician. I share from my own experiences. And I've been having some experiences. It has been many months since I left the IOP, which I had been going to since October of 2023. And got told by Hubhopper that I have to only upload 1 episode a month. So it's a little hard for me to remember what's been happening in a month. Not much has changed, except I'm going through the rudiments of establishing a rapport with my new mental health providers. I've been seeing this therapist and this psychiatric provider. She's a nurse practitioner, but she's qualified to prescribe psych meds, and she's been prescribing a very low dose of medication for me, and I'm going to talk about what's been going on. I see her once a month, and she called in sick last week. We were supposed to meet for our monthly visit, and she objected very strongly to me being on a low dose of medication. She wanted to put me on a higher dose of antipsychotic meds. And given my history of being sensitive to antipsychotic drugs, I had to be assertive and be my own advocate and tell her that I needed a half of a dose of the medication. I wasn't about to go and take the full adult dose because I'm sensitive. She did not like that, but she did concede and let me take the lower dose. And it is sedating me, but less than it might have if I had taken the full dose. I'm not sure I would have been able to function, so I can say I told you so to her, but I didn't get to because she called in sick last week. My thoughts started racing, and I started wondering if she was rejecting me as well because I didn't want to take the full dose. That was just how my mind worked. When a provider, in my experience, when a provider thought I was being non-compliant, they would usually excuse me from their practice. And I got a covert excuse from practice a couple of decades ago. I had told this other doctor that I had left another mental health facility because I felt like I was being abused there. And she had suddenly started leaving town during our appointment times. Like for example, if I had an appointment on June 24th, she would mysteriously leave town, be out of town, and I would get a call from the secretary saying she was out of town. And I know it's a pattern because it happened even when I rescheduled the appointment. I would reschedule it, like, say, for the 30th of June. I'm just giving examples of dates. And then I would get the secretary calling me back on June 29th, and they would say, The doctor hasn't come back from town yet, or the doctor had to go away on another trip, and it just kept going. And the end result was I would run out of my medication and I would start decompensating. And after that incident happened about 3 times, and even the next month of my scheduled appointment, it happened again, and I was completely out of medication. And I begged the nurse and the receptionist to let me see the doctor, the other doctor that was taking over, and for in her absence, the doctor's absence, and they kept saying, no, we can't do that. We can't have you seeing him because he's not your doctor. And I'm like, wait a minute, isn't he substituting for Dr. Ferreira? I'm just making up a name. And they said, well, yeah, he is, but he's not your doctor, and you can't force us to make an appointment. So they just kept making excuses, and in the meantime, I was totally out of meds. I was going through antipsychotic withdrawal. I was decompensating, and that night I had to go to the emergency room and get a refill there. And the psychiatrist on call was kind, but she said, I'll prescribe another month of meds for you on one condition. You get another doctor who will prescribe your meds on a regular basis. Well, I couldn't find one because I couldn't find one with my insurance. And I got discouraged and just stopped going. And I gradually weaned myself off the meds myself at that point, and I would never recommend any other client do it. I'm not a professional. I have no right or legal license to recommend you going off your meds on your own. I did it only because I had done it before, even earlier in my life. I seem to know how to do it. I think I gradually weaned myself off. I would take maybe a pill every other day or something. Of course, I didn't tell the ER doctor. I didn't go back, and I went to the emergency room, and that was probably because I wasn't in withdrawal. I was going off the medication more gradually. I wasn't just suddenly going off it because I was running out. So it was a really eventful time for me. So I'm scared. I'm afraid it's happening again. And I have to deal with my mind going and racing. I'm supposed to see my therapist tomorrow, and I'm scared she's going to call in sick too. But we'll see what happens. I'll give you guys an update next month. I'll give you guys an update in August, inshallah. If all's going well and I'm able to make recordings, I'm able to function. On the personal front, I mentioned last month that I was trying to get over Ursula, and I couldn't really get over her. I wanted to see if I could have some closure with her or reconnect, depending on what was going to happen. I was still kind of in limbo, wondering what happened, why she didn't call or text me after I left the last program I was in, the IOP I was in for the past year and a half. And I got advised by my mentor and my girlfriend to go someplace where I might run into her. And I did a little bit of research. I knew her last name, and I searched her on the web and found her father, and I thought, okay, maybe I can talk to her father and go from there. Well, I decided not to do that, and I didn't want to weird him out. And then I looked up AI again, and I said, okay, she mentioned she was at this board and care on a particular street in the city. And can you please calculate AI where she might be? Is there a board and care like around this vicinity, around this street area in town? And AI said, okay, it sounds like you might be looking for the board and care called blah, 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 blah. Called board and care. I'll just say board and care. Called board and care. And I'm like, thank you. And I looked it up, and sure enough, it was on the map. And I thought, okay, the public transportation goes along this route and along that line. And I thought, okay, I don't want to try and run into her outside the IOP establishment, because I don't want them catching me snooping around. I don't want to snoop or even look like I'm snooping. So I decided to go along the route where she might be taking the transportation from the IOP, not where the IOP is, but maybe along the route, like further down along the route towards her board and care. And I was able to literally map it out on Google, and I found a route. I mapped it out and searched it. And yesterday, I was on my way to my girlfriend's, and I thought, okay, maybe on my way back from my girlfriend's, I'll plant myself somewhere on the route in a familiar spot on my way back from my girlfriend's. And I did. I planted myself in front of a store that was near the bus where I knew that she was going to be getting off the bus. And sure enough, no kidding, I am not kidding, I didn't think this was ever going to happen. I timed it out. I thought, okay, she probably gets out of the morning IOP at blah 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 time of day. I think I'll just make up a time. She gets out at 3 p.m. No, not 3 p.m. She gets out at 2 p.m. and she would probably arrive at this bus stop where I'm standing at approximately maybe 4 o'clock, or no, not 4, 3:30 something, 2:30. I was just kind of mapping it out in my mind with time. And sure enough, I saw her get off the bus. I'm not kidding. I saw her get off the bus. And I remembered to kind of plant myself in a place where she was not going to see me, because I didn't want her freaking out. I was going to maybe call her name, and just kind of act like I wasn't just in the area, like at the bus stop waiting for, because I looked like I was waiting for a trolley. For all she knew, I could be, going out in the other direction that she was coming. And then I saw her go into the store. I was kind of off in the corner somewhere, just kind of pacing around, acting like I was walking away, like around the block or whatever. And I saw her go into the store. I kind of casually turned around over my shoulder, and I saw her go into the store. Then I kind of walked back and past the store and up and down, and I went and sat on a bench where the bus was stopping on my side of the route, on my end of the route, my side of the route. I was kind of across the street from where she got off. And she was in the store across the street. And I guess I must have tried to look a little too casual, because I saw her come out of the store, and she walked past me. I don't know if she saw me or not, but I saw her kind of out of the corner of my eye. I was sort of looking in the other direction, but I saw her out of the corner of my eye. I kind of sensed some movement. And I heard her voice. I think she was saying excuse me to someone. Like, excuse me, but I recognized her voice like I recognize the color of my jacket. And she was walking by, and then she was gone, because there was a trolley, or there was a bus there was a train, or one of the transportations on the route, and she must have gotten on, because next thing I know, I'm looking around and I can't find her. And maybe it's good. Maybe that's good. I waited for another 10 minutes, and then I called my mentor. I called my mentor in Canada, and I said, I think I've spotted her, Ani. And he goes, oh, really? Did you say hello to her, Carol? And I said, I didn't. I was too shy. And he goes, why didn't you say hello? And I said, because I really think it's over. And I'll tell you, ladies and gentlemen, why I think it's over. She's looking a lot better. She's not looking like someone who belongs at the IOP. In fact, when I searched her father mentioned something about her late sister. She's deceased. Her late sister was sending a prayer to her father, to their father, to pray for her, because the said person is dealing with an ailment. And I thought, well, she looks like she's in much better medical condition. And I thought, she doesn't need me anymore. She's not looking the same as when she was at the program. She doesn't look so sad anymore. She looks happy. And I think I'm coming to this conclusion that if I approach her now, not only am I gonna appear like I'm stalking her, I'm gonna appear like I'm this needy person who hasn't recovered yet. To her, someone who's, getting better. She looked a lot better since she came out of the hospital last year, and her hair is even different, and she's smiling. She's looking really happy. So I think if there's any way I'm going to affect her right now, it's in a negative way. I'm going to be only getting in her way and stymieing her. So I decided to just stop even trying to connect with her. And right now I'm just feeling really sad. In fact, when I logged on here, I thought I was going to cry, and I'm not crying. Maybe I trained myself not to cry, but earlier I was crying. The tears were starting, and I had to come into the back room. My roommate's asleep, and I don't want to wake him up with my crying. But it's going to be hard. It's probably going to hit me between now and August, between now and the next time I put up a podcast. I'm probably going to be putting this podcast over on Spotify as well, Spotify creators as well. So you'll probably see me on both my podcasts. If I put this up on YouTube, yeah, I'm gonna maybe convert this into a video and put it on YouTube as well. But I wanted to give you guys an update. I'm also experimenting with AI music and expressing myself through songs. So dealing with heartbreak, dealing with desolation right now. I miss her, but I don't think it's her that I miss. I think it's the idea of her that I miss. And I think it's being able to go to the IOP and coexist with her. If my therapist calls in sick or my psychiatrist decides not to see me anymore, I promise I will be safe. I will try and find another provider. It's going to be hard. I lucked out with this one. The clinic that I'm going to is in network, so I've been able to see someone since May, but I hope I can keep seeing them. But I'm going to maybe look around for another treatment program if this doesn't work out. But it's not going to be the IOP that I've been going to. I think I got excused from their practice. They thought I wasn't showing up on a regular basis, but that wasn't true. I was trying to show up. But it was just so painful dealing with her. With Ursula. It was painful. All right. Well, I'm going to go. Been on for about 20 minutes. Hope you guys are still having a safe summer. You're loved. God bless in mental wellness and in universal ethics.